Hi everybody. I'm creating this video in response to the massage community, naturopathic community, and chiropractic community's response to COVID-19. Most people have closed their doors and are saying that we are not a medical profession and that it's not necessary care. I've heard lots of massage therapists say that massage is never medically necessary, and I want to challenge that. So there is a difference in spa massage and feel-good massage and in medical massage. And mostly the difference in that is actually mindset. It's the mindset that I as a practitioner go into the session with and the expectations and engagement that I have with my clients. So let me just give you a little bit of my background. I've been a massage therapist for 12 years, working with injury rehabilitation and pain management. And the things I see quite often actually are where massage can help correct issues that my clients have not been able to get corrected when they go to their doctors. For example, I have a client who had some severe issues with her hands and wrists. So she couldn't grip, she couldn't like take jewelry on and off, she couldn't take a jar lid off. She went for years, she had this trouble for 25 years. She went to different doctors, they did tests, they couldn't find anything wrong with her or anything that was, that they deemed the problem. So she just dealt with this problem thinking that it's her life now. She actually came to see me because she had a rotator cuff injury at the gym, and she really wanted to be able to do pull-ups and push-ups, and she couldn't because whenever she'd try, her hands would hurt and her wrist would hurt. So I worked with her and discovered that there was just lots of impingement in her soft tissues, through her neck, through the nerves in her brachial plexus, and down through her hand and wrist. And after about 3 months working together, it totally cleared. She was astonished that she could open jar lids again, she could put her necklaces on and off, she could grip things, she could do her pull-ups, her push-ups, no problem. So that massage helps with that, but the right kind of massage. So in that scenario, when I go and I sit with a client, I'm finding out what's going on with them, what is their history of that issue, and what have they already done to correct it, what makes the issue worse, what have their doctors said, if they had imaging, I ask for the interpretation of that imaging, things like that. If they give me permission, I can speak directly with their physical therapist or their doctor. Now, I can't diagnose as a massage therapist, and so whenever they have a diagnosis, I can look at that and work with that. So a lot of times doctors will actually give a prescription with a diagnosis, and I can work on that. However, what I can do is assess the situation and try different things and see what works with the body. So with this particular client, I started by working with the neck and the chest to work through the brachial plexus, which is a bunch of nerves that go down to the hand. And that got a little bit of results. So I did that the next session, in addition with some things underneath the shoulder girdle. So it's that mindset where each session I'm looking at, did this make a difference? Let's try something else. If it did make a difference, let's add to it. I'm testing her range of motion before and after our session. I ask her how long the results lasted, what kind of motions she could do, what made it worse, what made it better. And every session is different based on the answers to those questions. And so there's this real engagement with medical massage that regular massage doesn't have. Another example is a client who has chronic pain, and she's been to doctors, they can't find anything. She's had MRIs, x-rays, all sorts of stuff. And her doctors are basically like, it's all in your head. Well, maybe it is, in her nervous system as well. So she's ex-military, she's been through a lot of trauma, and the thing that machines can't see is that the nervous system, when it's keyed up, when it's guarded, it creates chronic tension and pain. So it's like this. It's guarding. It's tight and tense. And so in that case, my job is really to get her nervous system to relax and to have an experience of being safe. Because the experiences she had before trained her nervous system that she is not safe. And so therefore, it created guarding and it created this chronic tension. So as I've worked with her over the past several months, I'm slowly getting her nervous system to relax and calm, and she's been seeing results now in the reduction of her pain, the chronic pain that she's had for 5 years. So this is what massage can do when we know what we're looking for and addressing that specifically. Another client I had, and these are just a few examples, but another client I had chronic low back pain. He went to the doctor, got x-rays, got MRIs. They found nothing. Not even some impingement in the vertebrae or anything like that. And so when I started working with him, I started working with the hip flexors, the psoas, the quads, basically everything that compresses the spine whenever we sit. So I understand that our body's mechanics, the way we sit or stand or walk, how much movement a person has, that affects the chronic tension that over time develops into potentially chronic pain and dysfunction. So with this client, we worked for several months getting his tissues to lengthen back out, those tissues that have been chronically short from a lifetime of sitting and from stress, and then I recommended to him stretches. He was working with a physical therapist and a physical trainer, so he was able to strengthen the muscles that were weak, lengthen the ones that were tight, and I was able to work with the scar tissue that had developed over time through those really tight muscles and the tissue, the myofascial tissue and the other soft tissue that was just stuck. So after 3 months, he was able to go back to his regular sport. So he loved soccer, he loved to jog and to run, go to the gym, all that sort of stuff that he couldn't do before. His low back was so bad that it hurt to sit, it hurt to stand, it hurt sometimes to lay down. Like when he woke up, he would be in pain. And this is a kind of pain that's like 8 out of 10 chronic pain. And this is something the doctors just told him, take pain medication or get surgery. This is what medical massage can help with. And so the problem that I'm seeing with the massage community and the chiropractic community now saying massage is not medically necessary, we should all close our doors for the health of all because we can't keep social distance. Well, nurses can't keep social distance either in the hospital. And guess where these people are going to go to if they have chronic pain that they have nobody else to take care of? The hospitals, the ICU, the places where they can get some relief or some answers. So in my opinion, it is part of my responsibility as a medical massage therapist to help the community at large the best I can, and that's so if I have the proper equipment to keep out all my surfaces clean, have them follow the guidelines that the CDC recommends, all that sort of stuff, of course, I put in place. But here's the thing, I've put that stuff in place anyway. That's part of being a massage therapist, is keeping my surfaces clean and not working with people who are sick or not working on people while I'm sick. So these are things that's already in place. And yes, it's a risk, but it's also a risk for our nurses that are in the hospitals who have to do the work. So I want to challenge you, my community of massage therapists, chiropractors, naturopathic doctors, that we can help with this problem by doing our profession and doing the medical massage. So right now, it is mandated that massage therapy close their doors unless we're doing medical massage, which is where the person has a prescription from a doctor or a referral from a doctor to get massage. So, and that's great. I work with that anyway. Now, I want to explain just a little bit the difference in spa massage. And it's a mindset. So in the spa massage, the relaxation massage, typically the massage therapist has a routine that they do, something that they were taught based on a technique. Maybe it's Thai massage, maybe it's Swedish massage, maybe it's a deep tissue, maybe it's an ashiatsu. It doesn't really matter what tool they use, it's the mindset that they bring to it. And it's basically like, okay, I'm going to do this routine on this person, boom, done. And it feels nice, and it does help. It helps a person relax and feel nurtured and feel taken care of. It helps circulation. It helps just overall with the immune system, things like that. But it's very different than the mindset of engaging the client in their treatment plan, engaging the client's other doctors, figuring out what the underlying problem is, trying things out, shifting. It's sort of like as a medical massage therapist, I'm like a detective, whereas if I were doing just spa massage, I'm sort of just doing massage. And again, there's nothing wrong with that. It just has to be a clear distinction. So once again, just there's a difference in medical massage and how we can help the medical community right now and our clients, and just relaxation spa massage. So if you're curious, want to have a further conversation, you can find me at www.lifelongwellnesspdx.com or send me an email, Adinah, ADINEH, at lifelongwellnesspdx.com. Cheers.